Hey guys, welcome to the Red Pill podcast. We are going live. Meter website is something that I'm following. It's much faster, it's much more up to date for some reason. The live counts are not as fast as this current Worldometer website. It tracks all the numbers. It's not a live count, but it updates itself every 2 minutes, and I think it's very reliable. We are just going to refresh it. I'm streaming it from my phone. And as you can see, it's just going up. There's just no way it's going down. It's weird. It's actually higher. So the active cases are currently 737,473, out of which 37,000 are critical, which means approximately 2%. That's just around I would say 5%. I'm so sorry, are seriously critical out of the current active cases, which means that there's a huge chance that out of these 37,000 cases, very few will come out, which means you will see the and also we would like to know that there have been recovery of around 210,000 people, which means it has a very good, the recover 20% of people who have been so far infected have more than 20% have been released. Now, if you look at this current chart, this linear scale, it will show you the inception and it will show you in the amount of thousands how it's scaled. As you can see, we are still very much near the peak. uh, it's very hard to say if it has peaked yet or not. I personally believe as of 2nd April 2020 it has not peaked, because US has just started active testing. They started active testing about 2 weeks ago, and that's why the number of cases have spiked huge. US is a big country. Russia is also one of the new upcoming clusters. So these two huge continents have started testing, and they are reporting active cases also because of the huge landmass of United States of America and the many number of states. It's very hard to keep a check on the number of viruses. It's also very hard to stop the spread of the viruses once the community spread starts. And the domestic travel in the US wasn't stopped. I don't believe it is still stopped. So people who were affected in one state, they went to another state, and so on and so forth. Also, they haven't, even if they stop domestic, they can't stop the state routes, the highways. So it's nobody's fault. It's just the way our system is. It's very, very hard to stop a pandemic once it comes in the community spreading. Because let's just accept it that now we are every country is a populated country. Every metro city is a dense area. Coming to that, the largest democracy in the world, India. If we come to India, now India is the next, it can be the next deal breaker or the deal maker if we go by country. So as you can see, US is now at 235,281 cases, which I believe is what Fauci said about 4 weeks ago, which now they are projecting to 1 million to 2 million cases. So they are expecting this number to go about 5 to 10 times more, because this is just number of the cases. Remember, the virus grows exponentially. So anything you see, just multiply it by 10, because every person has the potential to infect 5 to 10 people. So if this is the number of confirmed cases now, in 2 weeks this can be 10 times, right? The number of deaths are 500,603 so far. There are new deaths coming, so I believe it's in the 6,000 range now, which means US is now the second here, will have the second highest death toll in a few days. And you heard it first here. So these countries are developed countries and they have very good Medicare and healthcare system, but it's just the number will kill you. So you no matter how developed you are, you will never project these many beds and these many ventilators, and so that's the problem. So if we come to Spain, Spain is really growing very fast. If you look at here, the number of new cases in Spain is higher than that of Italy. So at this rate, because Italy is now dropping, it has peaked. So therefore, Spain will peak next, which is near the peak in the next cycle, next week, and then US. US, if it blows, because you can see the number of new cases in US is 20,000, and this they have just increased the number of the amount of testing. So US is which will USA will be the country. USA and India. India is very far behind, but USA will be the country that will take it to the next million. If any country will do it, it's USA. Germany is trying to slow down. One thing about Germany, the number of deaths in Germany have been the least throughout the world. Germany has 83,875 cases so far, and it has it's also growing at a very high rate, just next to Spain, but it's controlling the number of deaths. Look at that. You had 10,000 deaths in Spain and 1,000 deaths in Germany. The percentage, if I tell you the percentage, that's all that matters. That's all that matters. Death per 1 million. So the highest death rate in the world is, I believe, is Italy. Italy has the highest death rate. Obviously, we know that the news every day we're looking at. Every day a new record is being set as the number of deaths per day. So therefore, it has got a very high death rate, which is 230 people for every million people. And and they had a very good healthcare system, but it's just the numbers. Nobody can control that much people coming in sick. Spain is the second country with the worst death rate. So this tells you a trend in the European countries. These countries are the countries where there is a large amount of elderly population, which means that just too many people which are above the age of 60, 70, and they obviously at that age have underlying conditions. Belgium has a huge death rate for some reason, because there's a low population, I guess, and there have been a huge amount of cases there as well. Netherlands has done a very good control. France is not as badly affected as Spain has in Italy. Therefore, the death rate is quite low. So as you can see, UK is also low. I just believe that for some reason more young people were infected in these countries. And so what I'm concerned about is my country, which is India. So if we look at India, now one thing I'll tell you about India is in a 21-day lockdown, which ends on the 14th of April this month. There were speculations that this will be extended, but so far we have not extended it. The good thing is that Narendra Modi, our Prime Minister, Honorable Prime Minister, was the one who initiated this lockdown. And so Narendra Modi is, Prime Minister Narendra Modi, he activated this shutdown in India, and this is the largest shutdown in the world, the democratic shutdown, that is. So Narendra Modi, sir, he made sure that there was a 21-day lockdown in which there were no commercial activities, nothing. Everybody was at home, everything was shut. We were having a lot of problems, but everybody cooperated, and we have kept the graph very low. The number of new cases is low. The number of deaths is extremely low compared to the number of cases. So India is doing a very good job as of now, but we have just had a very bad scare. It's called the Nizamuddin scare. So there was a prayer meet, I believe. There was a religious meet of a certain Islamic group, and they were basically, when there was a shutdown and no more than 2 people were allowed to gather, and there was section 144 in Delhi where nobody more than 4 people can gather, there were these people who were meeting together, and they were meeting together to for prayers, for their prayers, which is completely fine. But you can't do that in a lockdown, when especially there were a lot of people from Indonesia traveling in that group for prayers as well. So we have had a huge number of positive coronavirus cases, and out of those, like 1,500 people were gathered and they were put in a bus, and now they have been isolated and they are being tested for coronavirus. But because they 2,000 people together were there and they gathered, therefore there are a lot of positive cases popping up in India now. So India is kind of on the edge of its toes. India, if they can control this, it's great. If they can't, nobody can say what's going to happen. Australia is doing a fantastic job. Um, and that's it. So I'm just here to update you that we have to take this very seriously, because I am tracking this worldometer for quite some time, and I can't tell you that this graph scares me to the point that I can tell you, because I was taking a good track of it, but it just, over here it just went nuts. At 17th March it was just like, what's happening? Because 10th March was when Italy shut down. 10th March officially, 9th to 10th March is when Italy officially shut down the whole country. But after that it was just, and at that point the number of deaths in Italy was just like 400 per day, 300 per day, which was huge. But then it became 700, then it became 800, and then it peaked at the 1,000 deaths per day, and then it just went on. And what we're seeing, this is the deaths chart, this is not the number of cases, this is the number of deaths, is that how it went up, and it's still going up. Because what happened till 29th of March, Italy was the highest deaths per day, and then suddenly you had US contributing in the number of deaths, you had Spain contributing in the number of deaths, and then it just went up. And I still see this peaking, it's not gone anywhere near the top. So that's not good news again. I wish I had any good news for you, but I can say one thing, that I think because of the shutdowns in many countries, the number of cases are going to slow down. But it's going to slow down now. Because the shutdown in most countries started in 15th April, this could have been way low, but uh, because the shutdown started on 15th April, that's where the spreading slowed down. But till then, the incubation was up. So this week, you will get to know who all is positive, and then you can tell if the shutdown was possible. So the next 2 weeks, as our Prime Minister and everybody in India is saying, the next 2 weeks is crucial. And as you can see, it's inching close. It's inching close to the 1 million mark. And I don't want this to go where I think it's going, but that's it. There we go. 1 million cases. 1 million cases. We have crossed 1 million people in the world has been affected by the coronavirus COVID-19, and that's very sad. Because, and you can see the number of deaths are at 51,354, which is like unbelievable. And I remember scientists saying that this was not as deadly as SARS. SARS infected, hardly killed 800 people. This has killed, I don't know, 400 times, 40 times that. It's killed more than 60 times the amount of SARS. 60 times. That's how it's 60 times. Right now, it's 60 times more deadly than SARS, and God knows where this number will go up. Yeah, 210,191 people have recovered. It's the number of patients. I just want to show you which country is the most affected as of 2nd April. This is it. So USA is obviously the highest, the most affected country. USA has 235,747 people, and new cases are really high. 20,000 cases. It's unbelievable. It's not the highest death rate in the world, but it is the highest number of active cases in the world in the USA. Italy at the second number, Spain at the third number, Germany is fourth, China, where it all started, is the fifth number, France, a very distant fourth, fifth. Then you have Iran, where I guess maybe the reporting is not right, or it's slowing down. UK is okay, it's also quite far, but it still has a huge number of deaths. So it's bad, and if you see the countries, Belgium, Netherlands, Austria, these are all Europe. So Europe is like if it's continent-wise, Europe is the worst affected continent for the coronavirus. There's no doubt. And then let's see where US goes, death-wise. Right now, America has more cases than anybody else in the world, but it doesn't have the largest amount of deaths in the world. That's Europe as a continent, and Italy. So we hope that this slows down. We really, really hope right now. India is in a complete lockdown. India until 14th April, India is shut down. You can see the number of cases at 2,341. It seems low, but I want to tell you, just a week ago, this was less than half. Less than half, just a week ago, or less than a week ago. And it's growing. It's growing because of the new, there was a huge Islamic prayer meet in Delhi, which is the capital, and then they went all different states of India, and they are popping up everywhere. So basically that has become a huge, like a super spreader. And they did this despite knowing that we were in a lockdown. So they were breaking the rule on purpose. So there is no good news here. Every country that you see over here is actively affected, and the death toll is, if I just show you the graph here, as you can see, the total number of deaths, this has not peaked. This is still going up, and the total number of cases is also going up. So I just don't know what to tell you. I just hope there's some good news in the next few weeks where the shutdown starts showing up some results. Till then, this is the Red Pill podcast bidding you goodbye. 1 million cases on 2nd April. Where are we going to go here from this?